And thanks for joining us on this Tuesday. We begin tonight with some positive news a year and a half into this pandemic.
That's right. The news comes from the Indiana State Health Commissioner saying that new COVID cases now are down for a third straight week. And we saw that in the numbers that were released today, too, with just under 3,000 new cases. Dr. Christina Bach says mask mandates in Indiana schools is something that she believed really helped.
And some more good news for you, this time from the CDC. The agency expects COVID deaths to drop over the next 4 weeks. And for the third straight week, the CDC has also predicted new COVID hospitalizations to drop as well. Now, the key to all of this, of course, vaccinations.
That's right. And so tonight, our Rich and I takes a look at concerns that our state top docs expressed about that issue today.
2 bandages for Krista Carlino, who got 2 shots Wednesday at the COVID-19 vaccine clinic across the street from the Speedway.
My right is the Pfizer booster, and then left here is the flu.
Carlino is among the first 35,000 Hoosiers to get a Pfizer third dose booster.
I'm outside of the 6-month mark. I'm a public educator, so I'm in the classroom 5 days a week with high school students. I'm also the mother of an 11-year-old little girl who can't get vaccinated, so me getting my booster protects her as well.
Those who are eligible can now get a Pfizer vaccine booster shot at clinics like this one outside the Indianapolis Motor Speedway. But state health officials remain more concerned about the 44% of Hoosiers who still have not received their first shot.
About 10,000 vaccine doses are going into arms every day in Indiana. Not enough to please state health officials.
If we continue at that pace, it could be well over another year before we achieve sufficient levels of immunizations to provide robust protection for the population at large. And none of us want that.
The state health commissioner raised special concern for unvaccinated pregnant women. Dr. Christina Bach says COVID causes more severe symptoms in pregnant women and increases risk for the baby as well.
The COVID-19 vaccine is safe to get if you are pregnant. Please do not put yourself or your baby at unnecessary risk. Our goal would be for all women of childbearing age to get this vaccine before they become pregnant so they are protected from COVID when they become pregnant.
Dr. Box also says there is no research that shows the COVID vaccine decreases fertility in women or men.
The state health department reports about 56% of eligible Hoosiers are fully vaccinated, but under 40 years old, that percentage is less than half, and less than a third of Indiana children ages 12 to 15 are fully vaccinated. Nationwide, 55.8% of eligible Americans are now fully vaccinated. That is more than 185 million people. COVID booster shots don't appear to produce more side effects that are more severe than a second dose. The CDC reports less than a third of 22,000 people who received a booster shot reported any side effects. The most common complaints are pain at the injection site, fatigue, and also headaches. Right now, the state is starting to deploy National Guard's Hospital Response Crisis Team.
That's right. Right now, 4 teams are helping hospitals all across the state, and that includes Ascension St. Vincent on 86th Street.
Tonight, our Lauren Costa explains how this extra help really works.
Last Friday, the National Guard arrived here at Ascension St. Vincent to help nurses and doctors who are overwhelmed and short-staffed. The chief operating officer says they applied for assistance a couple of weeks ago, and a team arrived a few days later. So here's how the partnership works. There are 5 teams consisting of usually 10 members, 4 medics and 6 general support staff. They are called the Hospital Crisis Response Team. Once a hospital applies, a team will be deployed for 7 to 14 days. This allows hospitals to fill ongoing resources and staffing needs, but it's only for hospitals that have exhausted all other options. And the medics are focused more on IVs and blood draws, while the general support staff does more of the cleaning and delivering meals. That way nurses can focus more on their patients.
YouTube is banning videos that make false vaccine claims. This new policy covers false claims saying approved vaccines are dangerous or ineffective and that they could cause autism or cancer. Experts say that is just not true. Now, YouTube also plans to remove the channels belonging to several well-known vaccine misinformation spreaders.